Ben, you okay if I go ahead?
Yes, we're ready to begin. Thanks.
Great. So I'm going to call the meeting to order. It is 6:33 p.m. and we'll start with a roll call of board members. Dr. Usama Bilal,
Present.
Dr. Tyra Bryan Stevens,
Present.
Dr. Ana Diaz-Rue,
Here.
Dr. Marla Gold,
Here.
Dr. Jennifer Ibrahim,
Here.
and Dr. Amit Ismail, I think is not here, and Dr. Scott McNeil.
Here.
Dr. Medical, Dr. Ismail should be joining momentarily. We were both coming from the same meeting.
Great, great. So I think it's okay if we go ahead with Ben can explain the public comment process now, and then hopefully he'll join us after that. So Ben?
Thank you, Dr. Bedigal. Good evening, members of the public. My name is Ben Hartung, and I will be facilitating the public comment process tonight. You're able to submit public comments to me directly by email, as some have done already today, and you also can use the chat function in this Zoom meeting to do that. And we ask that you keep your comments free from obscenity tonight, as this is a public meeting. And by participating in the meeting tonight, you are agreeing that you will be your comments will be presented on our YouTube channel, because this meeting is being recorded and it will be posted on our YouTube channel after it is finished pursuant to local ordinance. So again, my email for public comment is benjamin.hartung@phila.gov. Thank you.
Great. Thanks, Ben. So has the board had a chance to review the meeting minutes? And if so, are there any questions?
I'd like to move to approve.
This is
Second.
Jen, I'll second.
All in favor? Aye.
Aye.
Any opposed? Terrific. Thank you all. So next, just to review tonight's agenda. First, we're going to discuss an amendment to the fourth consolidated and restated supplemental regulation governing the control and prevention of COVID-19, revised safety measures and delegation of authority. And then we'll discuss the third amendment to the emergency regulation governing the control and prevention of COVID-19, mandating vaccines for healthcare workers and in higher education, healthcare, and related settings. So I'm going to ask Ben, I think if you could share the slides, there's just a few brief slides. So I'll walk through the sort of general sense of this, and then Ben will walk through the text of the revised regulation. So this is just the agenda that I just mentioned. Next slide. Okay, so the first regulation we're going to discuss is essentially talking about the mask mandate. The current status, just to review, is that we do mandate masks currently in healthcare institutions and in congregate facilities, including prisons and shelters. What we're proposing tonight to the board is that we end the mask mandate in congregate facilities other than healthcare institutions, that we continue to require mask use by healthcare workers who are providing direct patient care, just while they are providing that direct patient care, not otherwise, and that we eliminate the mask mandate in other settings within healthcare institutions, except for those who are required to mask either because they're in days 6 through 10 of an infection or they have a recent high-risk exposure. But otherwise, we wouldn't be mandating masks. So essentially, it narrows that mask mandate to only a healthcare worker who's providing direct patient care. And the rationale for this is that we are seeing decreased hospitalization and death rates, so we don't need as broad a scope to this regulation. So, and I don't know if you want to, maybe we can talk through once Ben has had a chance to read the actual text of the regulation, so that you're able to comment on the details of it as well as the general sense. But Ben, if you can go to the next slide. So then for the vaccine mandate regulation, the current status is that we mandate vaccines in healthcare institutions and in institutions of higher education. We are proposing to end the vaccine mandate for institutions of higher education, the rationale being that this mandate was passed at a time when we were all very concerned that college and university students would be a major source of transmission. That's no longer the case, so we no longer need this mandate. And Ben, I think you can stop sharing now. And if you could walk through the text of the first regulation, that would be great.
Yes, I will do that. Let me just pull it up on my screen here. And then I will share. Can everyone see my screen? Okay,
Yes.
great. So this is the amendment to the fourth consolidated and restated supplemental regulation governing the control and prevention of COVID-19, also known as the revised safety measures and delegation of authority. It was last updated on October 19th, 2022. So this is an update to a portion of that regulation as it deals with face coverings. And this whereas section sort of lays out the rationale that Dr. Bedegal just discussed. And moving down into the operative language of the regulation, you'll see that we're here under section 1, which is the generally applicable mask requirements. And we've made adjustments to the regulation to reflect the fact that only healthcare workers who provide direct patient care in healthcare institutions and not congregate care facilities will be required to wear face masks and face coverings, as they're called in the regulation. So you'll see some deletions and insertions in this section A, subpart 1, to reflect this change. And you'll see this addition at the end where it says that healthcare workers returning from a high-risk exposure or testing positive for COVID-19 shall mask consistent with CDC guidance in all areas of the facility for the period of time that CDC guidance requires that masking. And that section of the regulation actually appeared in this subsection 1A down here, which you'll see it was removed and just added the exact same language about CDC guidance for people with high risk exposure or testing positive has been moved up a section, and all references to congregate care facilities and other non-healthcare institutions have been removed from the regulation. Dr.
Cool.
Yeah, thank you for this. So this would remove the mandate as stated. The institution is left to define direct patient care, is my understanding, 1. And 2, healthcare settings deemed not to have direct patient care, a waiting room, for example, where care is not being provided, but there are high-risk individuals. Is it still up to that place? Are they still able
Yes.
freely to mandate based on their own data and any issues they have for patient safety?
Yes, so any institution would be free to be stricter than the regulation. So, a hospital could decide, for now or during this period of time or whatever they felt necessary, they wanted everybody masked at all times, but we're no longer requiring that if this were to pass.
Thank you.
Yeah, and I know you all did receive a copy of this, but if anybody wanted to spend time looking at the whereas clauses, we can certainly do that. I do want to highlight too, just to make sure it's clear, that this would apply to the person providing the healthcare. It wouldn't apply to patients. So we would not be mandating that patient's mask. And, our thought process here was, it feels like it's time to narrow this mandate, but, there are definitely people there out there who are still at risk. People who are immunosuppressed, people who are elderly. We don't want anybody who is afraid to go get healthcare because they are perhaps going to have to unmask for that exam and the provider might not be masked. They can mask in the waiting room. It's kind of a compromise. I mean, I think, and it may end up being, of course, like many compromises, something that lots of people remain unhappy with. But just to make sure you all are clear with what this does and what it doesn't do, is it would be a mandate for the healthcare workers. As you said, by direct patient care, listing that out seems very, very complex to do. But meaning the healthcare worker directly with the patient. So not a clerk checking people in, for example. Are there any other questions or points of discussion? And Dr. Gold, is your hand still up or is it up?
It's another question if no one else has, just very quickly for the record, which is long-term care facilities. I just want to touch on this for a minute. So, for example, workers in such facilities who would be bathing, taking at the bedside, someone who is elderly and compromised,
Mhm.
are no longer mandated to mask in that situation because that's not considered patient care, or it's up to the facility how it defines.
Well, no, that would be a healthcare worker providing direct patient care.
Okay.
So they wouldn't be required to mask if they're walking down the hallway, if they're sitting at the nurse's station, they could be unmasked. But if they're in with that elderly patient, bathing them, giving them medications, whatever they're doing, they would be masked.
Great. So we're not in a situation where, for example, adult children will wake up tomorrow and find that we inadvertently put their elderly parents in harm's way.
Yeah, I mean, it is less masking, right? And this would not require a visitor to a nursing home to mask.
Mhm.
But I think that's also part of that, trying to weigh the risks and benefits. People want
Understood.
to be able to kiss each other, for example.
Yep. Absolutely understood. Thank you.
Are there any other questions or discussion points? All right. So I think we'll take a minute to take a look at any questions or comments in the chat. And if the board would like to discuss or engage with any of those, I'm happy to do that.
Yes, there are a couple comments in the questions and comments in the chat. And board members have also provided you with an email with some comments that are largely not relevant to this regulation because they were received before it was presented, but they're there for you to review.
I want to note, if I could, that all the comments, I don't know if you mentioned it, Ben, that did come in advance, many of which are being repeated here in the chat, understandably, have been made available, at least were made available to me, and I think that's the same for my colleagues on the board. And that the science, the result of the Cochrane study and the study and every in and out of it is well known to all of us, and certainly well known to me as an infectious disease physician and public health person. And the way in which those studies are conducted are not specific to these settings and populations necessarily that we're discussing. The comment about the size of a virus and what a mask can do is incorrect. And the other areas do not support the comments about the protection of someone who may have contagious COVID-19 in providing care for someone who is elderly and immunosuppressed. So I will leave it at that, but I do want to alert the folks that are here with us tonight that the comments are taken very seriously and that we are always reading the research and looking at this. Some of it is nuanced. I think we have a nuanced wall of immunity, but the indicators in the city of Philadelphia under the direction of the health department are that we're going in an excellent direction and that we're still in the Omicron family, which is very good news indeed. So
Thank you for sharing that, Dr. Gold. Yeah, I would add that the Cochrane study has been reviewed by multiple epidemiologists, and unfortunately, it has been promoted as saying that masks are not effective for COVID-19, and its author actually made statements to that effect. Most of the studies were done before the pandemic, so they relate to other viruses and other conditions. But are there any other comments or questions from the Board of Health? And if not, is there a move to accept the regulation or to approve the regulation as written?
So moved.
Second.
All in favor?
Aye.
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 Any opposed? Okay, thank you. Ben, can you take us on to the second regulation?
Oops. Sorry, yes, I can. I was muted. So the second regulation that we're discussing tonight is the third amendment to the emergency regulations governing the control and prevention of COVID-19, mandating vaccines for healthcare workers and in higher education, healthcare, and related settings. So these are the whereas clauses in the beginning that again lay out the rationale that Dr. Bedegal presented during her PowerPoint presentation. Moving down into the text of the law, first we'll note a change in the title of this section of the emergency regulations to remove higher education. So now this vaccine requirement is applying to healthcare workers and in healthcare and other healthcare related settings. So the first change is to remove covered higher education individual and covered higher education institution from the definition section, as they're no longer applicable, and also from the covered individual section, remove the covered higher education individual portion of that definition. Moving down a little further, out of the definition section, we talk about the regulated individuals and establishments. And so we leave in healthcare institutions, and it keeps the regulation that the requirement that they have to be fully vaccinated or receive an exemption from the healthcare institution pursuant to paragraph 3 below. Again, we remove the covered higher education institution requirement for vaccination in this section, and also remove covered higher education institution from the exemptions where it's spelled out that covered individuals can be exempt from vaccination requirements if they qualify. So continuing down, you'll see that covered higher education institution is removed throughout. The effective date of this regulation was initially immediate because it was passed pursuant to emergency authorities, and this is no longer being passed pursuant to emergency authority, so it'll take effect in 30 days after time for public comment. And finally, again, removing covered higher education institutions throughout is the remaining edits.
It would help if I unmuted myself. Dr. Gold?
I don't want to take up all the air tonight. Just one place that wasn't clear to me, Ben. On the 30-day, are you saying 30-day for the remaining healthcare workers that are impacted, or from the time, if we vote on this as it is, when does it become effective? That is, when is vaccine no longer mandated at institutions of higher education in the city of Philadelphia, should this pass tonight?
It will become effective after it's posted by the Department of Records, which should happen if by latest on Monday, I would say. And then there's a 30-day comment period from that posting. And after that 30-day comment period is up, assuming we get no requests for public hearing, it will become effective.
So it's another at least month of this mandate in place at institutions of higher education.
So
should it pass.
I believe that we could administratively decide not to enforce during that month. You know, we do need to follow the kind of, we're not operating in an emergency for doing this. So we would want to offer that public comment period, and we can have a hearing if people want to have a hearing, but we don't need to, we could put something out to colleges and universities, letting them know that we're not going to enforce during that time, if that's helpful.
Thank you. I mean, from the information that we've been receiving, it may be helpful. I don't know the legal aspects of those institutions for what they need in order to change their
Right.
practices.
Yeah, I mean, we have a group of contacts at the colleges and universities, so we can reach out and ask them that question. And also make sure they're aware.
Okay.
Any other questions or comments? Okay. Is there a move to approve the regulation as written?
Oh, sure, I will add, Dr. Bedegaard, there's a couple comments coming through that we just want to review before we vote.
Okay. So if the board could take a look at the chat for any public comments.
And I will say, I just wanted to mention from having read the other comments that we have pretty good evidence of safety of these vaccines at this point, and I think that's important. That's really, really important here in this context.
So
And
I'm a member
Dr.
of the
Bedegaard-
public. Am I allowed to speak?
So you can place comments in the chat, and the board will read them and decide whether to engage with them or respond.
Okay, I've emailed the comments to
Thank you.
address.
Any other questions or comments from the Board of Health?
Just as a point of clarification, with regards to the point about not enforcing at this time, there's nothing that needs to be modified in the language here. That's something that you'll just be able to do administratively.
Yes, that's my understanding. Ben, is that also your understanding?
Yeah, that is my understanding. The way this amendment was written is an amendment to an emergency filing, so it was required to remove section 6 here about the effective date, but the enforcement of the regulation is at the discretion of the department.
Okay, thank you.
So were there any comments that the board wanted to discuss? And if not, is there a move to approve the regulation?
So moved.
Is there a second?
This is Jen, I'll second.
And all in favor?
Aye.
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 Any opposed? Well, thank you all very much. So with that, I'm going to adjourn tonight's meeting. Thank you very much for your time and for all of your dedication and reading through all these materials in advance and thinking through this. It is 6:56 p.m. and this meeting is adjourned. Thank you.
Thank you.
Thank you.
Thank you. Take care.